shi bynta ban Buddien ka jingshakri jong ki civil hospital kumjuh iki district hospital kylleng ki bynta jong ka Jylla nak liang ka Myntri ka tnad ka Koit ka Khiah Kong Ampareen Lyngdoh ryngkat Myntri Rangbah kila shong ka jingialang ka kyrkieh kumno ban pynjanai shuh ka jingshakri Haba kren berkilat pathai Khubor hynne ka sngi ka Myntri ka iathuh ba ka kren kila ru iki jingtip shapang ki babun ki jingduna ki bagite ki jaka sumar ki dankam ba ka mat ka baning kong ka dei kinong trei iathuh ru bala pentip iki shapang ka jingduna nadu ki specialist ki nurse ki doctor bat ki wei
before the Honorable Chief Minister this morning were basically to evaluate the performance of civil hospitals and district hospitals across the state of Meghalaya. We had reviewed the positions, the performance, the requirements of infrastructure, the requirement reviewed the indexes for evaluation of performance. And it was decided today that amongst the most critical requirements in all of these hospitals was the HR. And the Honorable Chief Minister is now informed about the shortfall of nurses, shortfall of paramedical staff, shortfall of specialists, shortfall of medical doctors. This evaluation was done with the purpose to ensure that we are able to track the performance of all of our hospitals, and we will await for another interaction with the Honorable Chief Minister to see what are the other areas and what are the financial inputs that government will be taking to ensure that our health system improves substantially. We are giving ourselves about 24 to 36 months and we will evaluate the performance accordingly. We have also taken a decision that it is important for us to incentivize services of health personnel across the state of Meghalaya. You will notice that in very far-flung places of services provided to the public via the health department, there will always be a resistance by health personnel across the board. So we are looking at the initiation of a policy that will firstly ensure that everyone in the system in the health department must have a compulsory difficult posting. Everyone in the health system should not, for example, take recluse to the fact that we do not have provisions for housing of the health personnel whenever they are posted out. We've evaluated the scales of pay of all health personnel and we have seen that there are provisions for acquiring of housing facility for doctors, housing facilities for nurses. We hope that we will be able to evaluate ourselves. This is a self-assessment. Before any third party comes, government should be seized of what are the potentials, weaknesses, strengths of our own services. We are also a little alarmed at the fact that referrals to higher facilities is a common practice in all of our health centers, our health hospitals, government hospitals. We are going to find out now, we're going to invest substantially on further detailed researching. Why is it that referral of patients is a common practice in all of our government hospitals? Why is it that patients ask for referral against medical advice in most situations? We are going to try and see whether or not the government can handhold the health department to ensure that we are able to provide the basic of all basic amenities to our citizens wherever they are located, without pressurizing patients to move out of their own areas, own homes, and to travel distances across either in the state or across to other states for their medical treatments. That's one thing that we feel is a top priority in the government, and this is what the Honorable Chief Minister reviewed. He has visited the Jowai Civil Hospital. He has visited, of course, his own constituency, the Tura Civil Hospital. We are shortly going to have a review meeting even in the civil hospital Shillong, and we are going to see how best we can turn around this faith that the public have in our health institutions. I think that this is a very, very important intervention of the Honorable Chief Minister, and we hope, like he has created a magic in reduction of maternity deaths, we hope that we will be able to have this reduction overall in the entire health system. We also talked about availability of essential drugs. That is a very, very important area, and Honorable Chief Minister has made necessary advices to the department officials to ensure that we generate individual dispensaries in every civil hospital or MCH hospital or these subdivisional hospitals across the state of Meghalaya.